My name is Sophie Perry, and this is my research project on investigating the antimicrobial effects of coconut oil's lauric acid and tetracycline against acne-causing bacteria. Acne is a prevalent skin infection that is commonly caused by the overgrowth of bacteria, such as Cutibacterium acnes or Staphylococcus epidermidis, on the skin microbiome. These bacteria are normally present on the skin, but damage to the skin barrier can result in excessive bacterial growth and chronic acne symptoms. The antibiotic tetracycline is one of the most common therapies for chronic acne. However, a rise in antibiotic resistance raises concerns on long-term effectiveness and overuse of this treatment. Historically, coconut oil has been applied as a therapy for short and long-term acne infection. Lauric acid, which makes up the majority of the medium-chain fatty acids in coconut oil, has demonstrated inhibition of bacteria related to acne development without damaging skin cells. Lauric acid shows potential to be applied as an alternative acne therapy, which could reduce the risk of increasing antibiotic resistance. So it was hypothesized that lauric acid would have a significantly higher antimicrobial effect against C. acnes and S. epidermidis in comparison to tetracycline. So the first phase of this process involved lauric acid detection and quantification in coconut oils. So a normal phase flash chromatography separation of virgin coconut oil was analyzed through gas chromatography, fatty acid methyl ester profiling, along with 3 different coconut oils, virgin, refined, and crude oil, to detect and quantify the lauric acid content separately. In the second phase, antimicrobial testing of S. epidermidis and C. acnes was completed. So a minimum inhibitory concentration test was completed using a wide range of concentrations of virgin coconut oil, lauric acid, and tetracycline. The bacterial viability of S. epidermidis treated with lauric acid and tetracycline after 24 hours was determined using the MPN method, and zone of inhibition was employed to identify inhibited growth of S. epidermidis against lauric acid and multiple antibiotics. So lauric acid was successfully detected and quantified in coconut oil samples. Shown in this representative image here, lauric acid was identified in relation to a mixed standard, and it's here in this peak here, in virgin coconut oil, and was found to make up around 35% of the peak area of virgin oil. Virgin, refined, and crude coconut oil had lauric acid content of 585.1 plus or minus 46.6, 691.3 plus or minus 28.9, and 658.6 plus or minus 24.7 micrograms of lauric acid per milligram of oil. During the second phase, lauric acid and tetracycline were tested at 500 micrograms per mil for their antimicrobial effects against S. epidermidis, and both treatments significantly reduced the log 10 CFU per mil after 24 hours compared to the vehicle control, although there was no significant difference between the 2 treatments. However, when tested at 125 micrograms in a zone of inhibition test, neither lauric acid nor tetracycline produced significant inhibition compared to the vehicle control. In contrast, erythromycin and amoxicillin exhibited significant zones of inhibition at the same dose. These results suggest partial resistance or decreased sensitivity of this S. epidermidis strain to tetracycline, given that previous studies have reported inhibition of multiple strains of S. epidermidis at concentrations around 30 micrograms per mil. In conclusion, this study successfully detected and quantified lauric acid in various forms of coconut oil and investigated its antimicrobial effects alongside tetracycline against C. acnes and S. epidermidis. Both treatments significantly reduced S. epidermidis viability. However, there was no significant difference between the bacterial viability of S. epidermidis treated with 500 micrograms per mil lauric acid or tetracycline after 24 hours. These findings warrant further investigation and optimization of lauric acid's potential role as an antibacterial acne treatment and agent used to address antibiotic resistance. Future directions should include optimizing the normal phase flash chromatography separation of coconut oil through using a wider solvent gradient to improve lauric acid separation, exploring different chemical or enzymatic processing of coconut oil to increase its antimicrobial effects against various strains, explore potential synergetic effects by combining lauric acid with effective antibiotics such as amoxicillin or erythromycin in order to reduce antibiotic resistance and lower antibiotic prescription, and to validate and optimize anaerobic culturing process processes to determine the antimicrobial activity against C. acnes. Thank you for listening.